So we have a patient here who has come in today. It's a younger girl and she's got a plantar wart underneath her first met head on her left foot. So because it's very painful to have an injection go straight into the sole of the foot, we're going in from the top side to then get underneath the plantar wart for the most effective, reduced amount of pain way to have the anesthetic go off. As you can see here, we have some blanching of the skin that comes out white, and that just informs us the anesthetic is in the correct area. At this point now, the patient can't feel anything. We go quite slowly to make sure that the anesthetic goes off as best as possible. We then start applying betadine to the area, just as a pre-operative procedure to try and reduce risk of infections. Plantar warts tend to bleed quite a lot when you do remove them due to the increased amount of capillaries that are through the area. Now that we're all set up, I start off by needling the verruca. And what this does is it breaks up all of the top surface and breaks up the verruca or plantar wart, so that when we do come to scoop it out and bring it out, it comes out a lot easier. Otherwise, it tends to be a little bit more difficult to try and break through the top surfaces of the skin. So now that it's been needled, I then move to a curette and start to remove the actual infected tissue. It tends to come out in a bit of a lump when you do it. The infected tissue all sticks together, so it's actually quite easy to get out. One thing that you've got to make sure with this though is that you do get all of the remnants of the plantar wart and virus out, otherwise it can come back again. So you'll see here that I continue to kind of scoop and clean up around the edges as best as possible to try and make sure that all of the infected tissue is out as best as we possibly can. Once we're happy that we've got all the infected tissue out, we then apply phenol to the area. So this is done again with the curette. The phenol is an acid type of liquid that aims to kill off all the rest of the infected area, but it also helps cauterize the nerves as well, which means that after this, it doesn't tend to be too sore for the patient. Using the phenol, we apply it for around about 30 to 45 seconds, and this can be either done once or twice. In this case, in this situation, I've just done it once. Once I finish with the phenol, I then clean out the area that's been removed, and it also neutralizes the phenol, so we're using alcohol there, just an alcohol wipe to go in and just clean the rest of it up. I then like to come in and add more betadine just to be better safe than sorry in terms of infection through there. As you can see, the wound will continue to bleed a fair bit, and that's absolutely normal for this type of procedure. Again, a lot of capillary heads through the area that promote more bleeding. Unfortunately, in Australia here, we're not allowed to use anesthetic with adrenaline in it, which would be the most ideal scenario for this case, where the adrenaline can help reduce the amount of bleeding that does occur. So as you can see with this, I do tend to like to use lots of dressing just for the bleeding. We're using sterile melon followed by sterile gauze just to go over the top of that. And then I like to use sports tape to lock it off, just because sports tape tends to be a little bit more secure than other tapes when doing this. So once we've got the tape on here, we ask the patient to then stand on it just to apply pressure to the bottom just to try and stop any excess bleeding. We then give them instructions how to manage this at home for the night, and we'll get them back in tomorrow for a review and change the dressing.